Is bladder urgency a sign of overactive bladder, OAB? Imagine feeling a sudden, intense urge to go to the bathroom that you just can't ignore. That is what bladder urgency feels like, and it is the main sign of overactive bladder. Overactive bladder is a condition where the bladder muscles contract involuntarily, creating that urgent sensation. People with this condition often find themselves needing to urinate more frequently during the day and night. They might wake up several times at night to go to the bathroom, which is called nocturia. Sometimes, the urgency leads to involuntary urine leakage, known as urgency incontinence, which can be embarrassing and disruptive. Bladder urgency is different from other bladder issues because it directly reflects abnormal activity of the bladder muscles. Normally, the bladder relaxes when it fills and contracts when it's time to empty. But in overactive bladder, the muscles called the detrusor muscles contract too early or involuntarily, causing that sudden urge to urinate. To diagnose overactive bladder, doctors will ask about your symptoms, examine you, and sometimes do tests like bladder diaries or urodynamics to see how your bladder is functioning. They might also check for other causes like infections or bladder stones. It's important to remember that bladder urgency isn't only caused by overactive bladder. It can also be a sign of other health issues such as urinary tract infections, bladder stones, or even bladder tumors. In some cases, neurological conditions can cause similar symptoms. Because of this, if you experience persistent urgency, it's essential to see a healthcare professional for a proper diagnosis. This way, they can rule out serious conditions like bladder cancer, which might also cause urgency along with other symptoms like blood in the urine. Treatments for overactive bladder often start with lifestyle changes. These include bladder training, managing fluid intake, and exercises to strengthen pelvic floor muscles. If these don't work, medications that relax the bladder muscles or nerve stimulation therapies might be recommended. Surgery is usually a last resort for severe cases that don't respond to other treatments. In summary, bladder urgency is a key symptom of overactive bladder, but because it can also signal other health issues, getting a thorough medical evaluation is vital. Only a healthcare professional can determine the exact cause and suggest the best treatment plan for your specific needs. If you're experiencing frequent or sudden urges to urinate, don't hesitate to seek medical advice to ensure your bladder health is properly managed.